Good morning, everyone. Thank you for joining us. The tragic loss of Sub-Lieutenant Abigail Corborough, Captain Brendan Ian MacDonald, Captain Kevin Hagan, Captain Maxime Miron-Morin, Sub-Lieutenant Matthew Pike, and Master Corporal Matthew Cousins is devastating for the entire community of the Canadian Armed Forces and for all Canadians across Canada. We grieve with their families, friends, and loved ones during this time of their profound loss. Communities from British Columbia to Newfoundland will be mourning their sons and daughters, their brothers and sisters, their husbands and their parents. We will be there for families, friends, and loved ones during this very difficult time, and the government will continue to provide all of the support needed to the families impacted by this tragedy. Nous accompagnons les familles des victimes.
We are with the victims' families in their grief and profound sadness. From British Columbia to Newfoundland and Labrador, people are grieving for the loss of their loved ones. We will continue to be there for the friends and families and loved ones during these difficult times, and we will continue to provide them with all the required support. Today, I am accompanied by Dr. Tam and Dr. Nu, who will begin by providing you with an update in public health statistics.
Hello, everyone. We'll start with the latest numbers on COVID-19 in Canada. There are now 62,458 confirmed cases, including 4,111 deaths. Over 27,000, or 43% of cases, have now recovered. Labs across Canada have tested over 970,000 people for COVID-19 to date, with about 6% of these testing positive overall. This is Mental Health Week, which began on Monday and continues through to Sunday, May the 10th. This year, mental health takes on a special meaning in light of the additional stress and uncertainty that we are all experiencing due to COVID-19. Across Canada and around the world, people have been struggling with concerns of all manner and scope during these long weeks. Fitting the theme for this year is social connection. We've said many times leading up to this week that while we're apart physically, there has never been a more important time to stay connected. Canadians have shown resilience, finding creative ways to remain connected virtually, while keeping close relationships with family, friends, and communities, even during holidays and important religious observances. But this doesn't mean our new ways of connecting have been ideal or without added stress. In recognition of the many challenges that we're facing, the Canadian Mental Health Association is leading the way on Mental Health Week by encouraging us to get real with our feelings. These mental health experts remind us that for the sake of our mental wellness, we shouldn't bury or hide our emotions. So as we move forward into the uncertain days ahead, let's not forget that we're on this road together and there is help. Don't be afraid to speak up and talk if you are struggling with the weight of what you're feeling. Talking things out can help you, and it can also help others who may be finding it more difficult to voice their own struggles. We might still be apart physically, but by talking about how you're feeling, you'll find you're not alone. Thank you. Merci.
Thank you, Dr. Tam. Dr. Nu?
Merci. Bon après-midi.
Thank you. Good afternoon. As usual, I will begin with the latest numbers on COVID-19 in Canada. There are now 62,468 confirmed cases, including 4,111 deaths, and over 27,000 now recovered. Labs across Canada have tested over 970,000 people for COVID-19 to date, with about 6% of these testing positive. This is Mental Health Week, which began on Monday and continues through to Sunday, May 10th. This year, mental health takes on a special meaning in light of the additional stress and uncertainty we are all experiencing due to COVID-19. Across Canada and around the world, people have been struggling with concerns of all manner and scope during these long weeks. Fittingly, the theme we've said many times leading up to this week that while we're apart physically, there has never been a more important time to stay connected. Canadians have shown resilience, finding creative ways to remain connected virtually while keeping close relationships with family, friends, and communities, even during holidays and important religious observances. But this doesn't mean our new ways of connecting have been ideal or without added stress. In recognition of the many challenges we're facing, the Canadian Mental Health Association is leading the way on Mental Health Week by encouraging us to #GetRealWithOurFeelings. These mental health experts remind us that for the sake of our mental wellness, we shouldn't bury or hide our emotions. So, as we move forward into the uncertain days ahead, let's not forget that we're on this road together, and there is help. Don't be afraid to speak up and talk if you are struggling with the weight of what you're feeling. Talking things out can help you, and it can also help others who may be finding it more difficult to voice their own struggles. We might still be apart physically, but by talking about how you're feeling, you'll find you are not alone. Thank you.
Merci, Dr.
Thank you, Dr. New. I'd like to take this opportunity to provide you with a quick update on the Canadian Armed Forces activities, both in Quebec and in Ontario. The Canadian Armed Forces have 660 members that are supporting care staff in 13 long-term care facilities. Most of them are either in Montreal or in the Greater Montreal region. The Canadian government is working very hard with the Quebec government to deploy more troops into at least 7 more long-term care facilities. Canadian Armed Forces are also working night and day for this deployment to take place as quickly as possible. So far, there should be approximately 1,000 members of the armed forces when the deployment will be done.
Forces is following the guidance of the Ontarian government. They are working very collaboratively to make sure that the 5 long-term care centers that were identified are provided with appropriate support from the Canadian Armed Forces, always under the leadership and the guidance of the Ontarian government. I will also want to take advantage of this opportunity to provide very brief updates on a few of the key programs that we have put into place to support workers, families, and small businesses in particular in the last few weeks. A total of 545,000 businesses have received an emergency loan up to $40,000 through the Canadian Emergency Business Account as of May 5th. In terms of the Canada Emergency Response Benefit, a total of 7.5 million Canadians have received at least one payment of the benefit, for a total of 10.9 million applications. 10.7 million of them have been processed already. And finally, regarding the important wage subsidy, emergency wage subsidy program, as of yesterday, 110,000 businesses have submitted their requests for reimbursement of these emergency wage subsidies. The information can, in most cases, be found on the part of businesses on their account, my account at the Canada Revenue Agency. The majority of these businesses have seen their applications processed by the Canada Revenue Agency, and many of them will receive their payment, their reimbursement of the Canada wage subsidies by tomorrow. Alors, ça nous permet de passer à la période.
So that brings us to the questions. Thank you, Minister. As usual, we'll begin with questions on the phone.
One question, one follow-up, opérateur.
Merci.
Operator, thank you.
Si vous avez des questions, appuyez sur étoile maintenant pour poser une question. Notre première question.
Our first questions comes from Raymond Fillon, TVA. Please go ahead. Question. I have a question for Minister Duclos to come back to the issue of the Canadian Armed Forces members. François Duclos yesterday was saying during his press conference that it was taking too long. Why is it taking so long to deploy 1,000 troops that they asked for 2 weeks ago? Answer. Thank you for the question. Of course, we know this is a collaborative exercise, and it's very close collaboration between the Quebec government, which, of course, is responsible and has jurisdiction over managing the long-term care institutions, and the Canadian Armed Forces. As I was saying a few moments ago, there are over 750 members of the Canadian Armed Forces that have already been deployed to support 13 long-term care facilities. We know that there will be an additional deployment for 5 other long-term care establishments, and overall we expect there to be about 1,000 members of the Canadian Armed Forces who will very soon be deployed for in a total of 20 long-term care facilities. Follow-up question? So 1,000 on the ground. The Prime Minister talked about more support for seniors. Will that be coming this week? Answer. Well, as to when, of course, the Canadian Armed Forces must work in collaboration with and under the leadership of the Quebec government. One of the extremely important issues that the Quebec government discussed with the Canadian Armed Forces was the support that had to take place in a context to reassure to protect not only their own health and safety, but of course to protect the health and safety of the staff that's already on site and the people who are being taken care of there. We know how important it is that these collaborative processes, when new staff comes in, that things must be done correctly. It requires training and integration and coordination. In response to your question on seniors, we were very clear. The Prime Minister reminded us several times that, and we understand that it's very difficult for millions of seniors in Canada and in Quebec in particular. And an announcement will soon be made because it is important to support our seniors in the difficult circumstances they find themselves in.
Merci, Monsieur le Ministre.
Thank you, Minister. Next question.
Our next question is from Christy Kirkup from the Globe and Mail. À vous la parole, please go ahead.
Hello, good morning. Thank you very much for taking my question. My question is about the recent outbreak in northern Saskatchewan, particularly affecting Indigenous communities there. Can you characterize the level of concern about this particular outbreak and what's being done on the ground to try and contain it?
Dr. Tam.
Yes, thank you for the question. And it is an area of concern because it is in a more remote area, but also with Indigenous communities in that area. So there's been a lot of collaboration between the province, the local health authorities, the communities, also Indigenous Services Canada. And the agency has offered this support wherever that's needed. So it is a collaborative response. As I understand it, local and provincial public health have mobilized some significant number of health workers to do door-to-door investigation to see if there's any cases, to do case finding, contact tracing. So they are really seized with the issue, and they do have sort of on-site laboratory testing capabilities, but we're also there to support them if needed. So I think people are taking it extremely seriously because these are more vulnerable situations.
Follow up.
Thank you very much. And just as a follow-up on another matter, I apologize if my pronunciation is off on this, but I'm wondering if the Public Health Agency of Canada is aware of reports of the Kawasaki-like illness in children in Canada, and if so, where are the cases that the Public Health Agency is aware of, and how many cases are we talking about?
So Kawasaki disease, or some variants of that syndrome, thus is observed on a regular basis for children after a viral or even bacterial infection. So it's a sort of immunologic inflammatory response. So the pediatric networks are looking at this, and there have been cases identified, but not necessarily found to be they haven't been verified to be linked to COVID-19 specifically. So those investigations are underway. I believe that there are investigations underway in different areas of Canada, including the biggest provinces, Ontario and Quebec.
Next question, please.
Notre prochaine question est de Philippe Vincent Foisier de Radio-Canada. À vous la parole, please go ahead.
Oui, bonjour.
Hello. My question is for Dr. Tam. I'll ask it in French, but you can answer in English if you please, or if Dr. New could answer in French, that would be appreciated too. This morning, we heard that there was not enough testing being done in the country, and therefore it's difficult to correctly assess the progression of this pandemic. Do you agree with that statement here in Canada? Answer. This is Dr. New. Thank you for the question. It's not so easy as to answer yes or no to your question when it comes to testing. There are 3 or 4 or perhaps more aspects to the issue. It's an issue. It's about testing the right people at the right time in the right place. And what does that mean? That means that we must also target people for testing if they have a good chance of being infected with COVID-19. It makes no sense to do random testing of everybody in the street because the risk of false positives is higher if we go about it that way. Another thing is that we have to test at the right time. Because even if someone is contaminated or infected, but it's very early in the incubation period, we may obtain negative results. But 3 or 4 or 5 days later, that same person may have developed symptoms and then more clearly be seen to have contracted COVID-19. And then when it comes to the right place, we know that in some environments such as long-term care facilities, of course, if there's one case in a place like that, then you have to test the staff and the residents to try and identify further cases. So these tests really have to be very targeted according to public health principles and medical principles to perform the right tests of the right people at the right time and in the right place. Thank you. Follow-up question. So you're saying that the chief scientist was wrong to say that? I'm sorry, I didn't understand your question. Well, what I'm understanding from what you said is that what the chief scientist is saying is that you don't agree with her. Answer. I'm not saying I don't agree. I have no comments as to what other people say, but I think that everyone is on the same path in thinking that it's very, very important to use laboratory tests in the best possible way in order to be as efficient and effective as possible in identifying cases. As I've said before, we must find the right cases and isolate them and treat them properly. And then we also have to do contact tracing following those preliminary tests. That's good public health policy. And if our interventions are targeted with these goals in mind, things will go well.
Merci, docteur.
Thank you, Doctor.
Annie from CTV.
Hi, it's Annie Bergeron-Oliver from CTV News. My question is for Dr. Tam and Dr. New. There are still a lot of questions about the degree of community spread and the same with asymptomatic transmission. And now in certain jurisdictions, people are being warned to watch for other symptoms from pink eye to abdominal pains. I'm wondering, one, what you can tell us about Canada's stance on asymptomatic transmission and how concerning that is. And two, until we have firm scientific evidence on the importance of those different outbreaks, how can we start reopening schools and the economy?
So I think, and it may link to the previous question, which is that provinces and territories are increasing their testing for people with almost any symptom, so even mild symptoms, just because some of the symptoms might be vague and some of the people may be what we call in the sort of really pre-symptomatic and or when they only have a few symptoms. So for sure that many jurisdictions now are opening up clinics where people with, even mild symptoms can get tested. So that is definitely happening. And the range of symptoms is quite broad. And so that's part of the strategy to look to see if there's any further activities in the community that we haven't, as yet detected with the normal set of symptoms. I think it is extremely important when any of the reopening plans is that for every establishment, whether it's a school or workplace, that there is a plan in place for the distancing between people, for all the hygienic measures, and also to watch for symptoms. Because if you are actually dealing with a virus, which is actually quite difficult to detect or deal with, those distancing measures and your hand hygiene measures are absolutely fundamental as people are opening up businesses, etc. And so I think and schools will schedule people so that maybe there's less students in a class, and of course using the telework and schools learning, just in order to increase the spacing. So some of those methods will still apply because of the characteristic of this virus. And we do know, based on more and more information, that this virus can spread in the pre-symptomatic and the asymptomatic stage.
Okay, now I'm going to be a bit of a pain and do a double-edged question. Sorry about this in advance. Dr. Tam, your latest projection said that there would be about 3,800 deaths by May 5th. Obviously, now we're up over 4,000. I'm wondering what you can tell us that means about where we are in the outbreak, about the control measures in place, and why our death numbers have gone up. And following to that, Minister Duclos, it looks like deaths are still going up. The number of cases are still going up. And yet right now the CERB is halfway through. Is the government going to extend the CERB beyond the 4-month timeline?
So the projections are a method of one method of looking at what might happen. So again, these are not exact numbers, but they're in the right kind of ballpark, whether it's 3,800 or just close to that on May the 5th, I think it was. It was actually extremely close, and there's a ballparking of the deaths. So what I think is happening is that the epidemic is actually still slowing down. So the number of new cases, yes, we will see the numbers being reported, but the daily increase continues to go down. So it has been at about 3% daily increase, and that continues in this sort of slowing trajectory. And we know that the doubling time is now probably around 20 days. So the epidemic itself is decelerating. But unfortunately and tragically, what's happening right now is that those who have been infected, of course, are coming to the end of the clinical outcome. And with so many long-term care facilities affected, I think that the number of deaths will continue to increase. And so the death, in terms of number of deaths and the projections, are very much, I think, dependent on some of the measures that are being put in place to prevent serious outcomes in those high-risk populations. So those projections will have to be adjusted again. So if there's more long-term care facility outbreaks, that is where the energy should be put in terms of further increase in cases of deaths.
Thank you, Doctor. Mike from Global, over to you. Oh, sorry.
Very briefly, and it's connected to the answer that Dr. Tam provided. We obviously knew from the start that we needed to implement the Canada Emergency Response Benefit quickly in order to make sure that Canadians could stay healthy while being able to put food on the table. So 7.5 million Canadians have received support from the CERB and will continue to be there for Canadians. Alors, on savait dès le départ que
We knew from the beginning that the CERB was going to be an essential measure. We wanted to ensure that Canadians could continue to remain healthy and follow the social distancing directives and keep washing their hands and do all the other measures that in many cases was going to prevent them from going to work. So remain healthy while still being able to make ends meet. And we will continue to be there for Canadians.
Monsieur le Ministre, Mike.
Thank you, Minister.
Hello, Dr. Tan. The Ontario Premier is calling for a national strategy on contact. Feasible, and what would something like that look like?
So I think that would, well, contact tracing, first of all, is an absolutely critical piece of public health measure as we go into the next phase or next steps of living with COVID-19. So it's a fundamental aspect of the public health response. And we know that public health units are doing this. We want, and if needed, we can help with increasing contact tracing capacity. So that means trained people who can also do contact tracing. That is already in place as the fundamental measure. But so how do we make it maybe even more effective and more efficient? Some of the discussions have been about whether certain new technologies could help. I think that's the area where people are interested in looking at, well, is there some sort of additional layer of solution that we can look at across the board? Because if people use all different kind of tools, then it'll be more difficult. And some contacts, of course, may go in between provinces. So I think that's an important area of discussion.
So on technology, the Alberta's rolled out an app to do some contact tracing with. Is that something like that? Could that be used across the country?
Well, I think different solutions are being sort of piloted or put on the table. So I think what we want is to make sure we know what's going on in every jurisdiction and learn what's been happening, because I think if there are certain tools that are better than others, that's the kind of knowledge that you want to share. Not just whether the application works, but all the other policies that go with it, like privacy, and which I think is the most paramount of some of the policy discussions. So all of those aspects are the kind of thing that we can help facilitate in terms of a discussion across the country. And then also to see if there's any one tool that might be useful to everybody. So I think those are actually quite active discussions right now.
Thank you, Doctor.
Yes, Sean Kilpatrick with the Canadian Press Photo Department. My question is for Tam, and it has to do with our immune systems. What happens to our immune systems when we are isolated?
So the immune system is quite a complex system, and it's affected by many different, domains. I don't think it's necessarily been studied. We know that even the immune response to the virus itself is still needs to be understood. I'm sure there's a lot of other studies related to mental health and all sorts of other stresses and what that to do to the immune system. And I think that's worthy of study, and for people who are more expert in that area to look at. But I absolutely agree that the immune system is a very complex thing, and you need to maintain both physical and mental health, and that can be difficult to do if you are at home. So all of that is some of the discussions right now. In order to sort of restart and reopen things is that it's not just the effectiveness of the isolation or quarantine measures from a public health perspective, is what are the potential negative impacts of those policy. So I think that goes into the complex discussion locally on how do they safely restart.
Is this a concern with children returning to school?
So I think, as I've said before, every local medical officer and chief medical officers are looking at this very carefully. You have to start carefully and monitor what actually happens when kids go back to school. And what we do, and younger children in particular, have much milder illnesses. And it still remains to be studied in terms of how infectious they are. But there's some studies that suggest that they are not as infectious, which may mean that they've had less exposure to the virus. But that is actually still need to be studied. In fact, some of the most important questions, I think, related to COVID-19 is the role of kids in transmission. And then, just like with adults, we don't understand enough about the immune response to the virus, except that people do generate antibodies. And we have to see how those antibodies might work and how long they last for.
Thank you, Doctor. We'll just go back to the phone for 3 questions. Operator.
Following question is from Hélène Buzetti du Devoir. À vous la parole, please go ahead.
Question. Minister Duclos, I'd like to come back to the CESB for students, the emergency benefit for students. There was a bill that was adopted last week, but it was fairly vague and many details weren't finalized and needed to be done so through regulations. Perhaps, for example, you might be able to keep more of the benefit even if you're working. So 1 week later, I'm wondering what about these details and what can you tell us about that? Answer. Thank you for the question. It is an important part of our plan to help all Canadians, and that includes students. I taught for 25 years, and I know very well that the impact of such a crisis can have serious repercussions on, for example, the decision by students to pursue their studies or to abandon them for now. And of course, it also depends on their ability to meet ends meet in the coming weeks. And they also need enough money to pursue their studies in the coming year. That's why very soon there will be more specific information provided, both by Minister Qualcho and Minister Leboutier, as to this particular emergency benefit. Follow-up question. So am I to understand that, yes, the original plan may be amended, and so these students, because especially for university students, the summer begins in May usually, and when do we expect the first checks to be issued? Answer. Look, we are working very rapidly on all of these measures, and very, very soon the further details will be announced on the same website where students can apply for the benefit. We expect this to take place smoothly and quickly, just as it did with the CERB. It just only took a few days for people to be able to apply and receive their benefits, and this time that will be true for students too. So we will very, very soon be announcing further details on that. Thank you, Minister. Operator, next question.
Our next question is from Laura Osman from the Canadian Press. Please go ahead. À vous la parole.
Good morning. I wanted to talk again about this inflammatory response that's being found in children. I understand there's no definitive link to COVID-19, but this news is, kind of freaky for parents, especially as they're considering sending their kids back to school as provinces start to look at that prospect. So what is your message to them if they're concerned that their kids may be more susceptible to COVID-19 than they thought?
So that the illness in children are milder. I mean, that's been observed across international studies. And so clinically, they have a much less severe outcome. That's not to say that rarely some more severe outcomes could occur, but that's basically what the scientific data is telling us. But of course, if there's any concerns, contact your health provider. Pediatricians are very aware of Kawasaki disease because it actually happens in other viral illnesses and infections as well. So it's not specific to COVID-19, and they will know how to manage that. And so I think, again, if there's any symptoms that parents are worried about, provinces are already, as I said, widening the scope in terms of just sort of looking at the possibility of COVID-19 in people with a whole range of symptoms. And so I think if there's any concerns at all, consult your health provider. But the bottom line is that we know that overall kids have much milder illnesses.
Follow up.
Thanks, Dr. Tam. I also wanted to ask about whether any progress has been made on gathering more detailed data about people suffering from COVID-19, like their race, sexual orientation, or socioeconomic status in sort of a centralized way.
Yes, so I think there's a number of gaps in that data, and I think at the national level that is something that is, there's an effort in order to try and address that.
Yes, Dr. New, I can just maybe add to that, certainly that at the technical level, our staff are having active discussion with our counterparts in the provinces and territories in terms of looking at those types of issues and seeing what's within the art of the possible. Certainly everyone is seized with getting, data in a timely fashion. And obviously everyone would like, the more variables or more data we have, it's great. But certainly at this time, it's always a balance between, what's feasible. Everyone's stretched in terms of working, under extreme circumstances. And so it's determining what are the key items or key pieces of data that we would like to collect, I think, at a national level from each of the provinces and territories. And certainly that needs that sort of a collaboration agreement between the provinces, territories, and ourselves. But those discussions are active and ongoing. Thanks.
Thank you, Doctor. Operator, next question, please.
La prochaine question est de Émilie Bergeron de l'agence QMI. À vous la parole. Please go ahead.
Oui, bonjour. Hello, my question is for Minister Duclos. I'd like to come back to the military assistance being sent to long-term care institutions. You mentioned 7 others. Are we talking about the ones still in the region in the Montreal area? Can you tell us more details about which institutions are being targeted? Answer. Thank you for the question. I don't have the details yet as to the other 7 institutions. This is a target that has been decided upon in agreement between the Canadian government, the Canadian Armed Forces, and the Quebec government. So, as I said, efforts so far have been targeting 13 main long-term care institutions, but 7 others have been identified. And I believe this information will soon be available and will be provided at the same time by the Canadian Armed Forces and the Quebec government. Follow-up question? When it comes to the wage subsidy, a week or 2 ago, you said that the first amounts would be provided on May 7th, which is tomorrow. Is that still the case? And how much money do you expect to be sending out tomorrow, if so? Also, are you considering broadening the scope of the wage subsidy? Thank you. 110,000 businesses had asked to be reimbursed through this wage subsidy, so they could pay their workers retroactively from March 15th to April 11th. We expect about 90% of those applications to have already been processed, which means that as of tomorrow, we also expect most of those businesses to receive in their accounts the reimbursements for these wages that they paid their employees over the last weeks. About 10% of the businesses need to provide us with more information, or to CRA rather. The agency has already been in touch with those businesses as to the future evolutions of this important program to subsidize workers' wages. Well, of course, there is still much work to be done, and we must keep consulting to ensure that that our country's economic strength can be maintained so that the economic recovery can take place as quickly as possible and as efficiently as possible. Thank you, Minister. One last question in the room. Hello, Minister Duclos. I'd like to come back to the issue of seniors. Do you recognize that seniors' purchasing ability has diminished during the crisis because they are on fixed income often? And if so, have you been able to quantify or measure that loss of purchasing power? Answer, thank you very much. Well, our seniors were affected in many different ways by this crisis, of course, and we're quite concerned as to about this group that's been disproportionately affected. And the price of food has gone up, of course, which is another concern because of supply chain problems and transportation issues that we've seen over the last weeks. There's also the fact that many of these seniors are less mobile. In Quebec yesterday, we saw that some restrictions had been eased so that they could go pick up their groceries themselves because because delivery fees may have increased lately. But Statistics Canada has not yet studied the exact nature of all the increased costs. But the increased costs are there, we know, and that's why Prime Minister Trudeau recently said, and it will soon be announced, further support for seniors. Follow-up question. The crisis isn't over. This morning, several people said that this is the end of the energy sector as we know it in Canada when it comes to tar sands especially. Do you share this opinion or not? Answer, well, of course, we are facing a completely unexpected crisis and a major public health emergency. But there are other emergencies that we must deal with too when it comes to climate change, for example. We're thinking of people's health, but we're also thinking about the health of our environment. They are connected. And over the coming weeks and months, the Canadian government is going to have to continue its efforts to ensure a clean and sustainable environment for Canadians. And that is going to require sustained investment to ensure an appropriate public health and a clean, natural environment. That's part of a healthy economy as well. We need a sustainable, healthy future. Thank you, Minister. One last question on the phone.
De Catherine Lévesque de la Presse canadienne. À vous la parole. Please go ahead.
Question. Yes, good afternoon. My first question is for Minister Duclos. 24,000 members of the Canadian Armed Forces who were in isolation and who could rapidly be deployed. So where are those 24,000 people? Well, the Canadian Armed Forces, as you know, are being deployed not only in Canada, but across the world as well, in many different ways. Canadians are rightly proud of the important work done by many members of our armed forces, and in so many ways. Over the last weeks, what we did under the leadership and directives of the Quebec and Ontario governments was to deploy some of those Canadian Armed Forces members to support long-term care institutions. We know how much the crisis in these institutions have affected all of us. So this is a commitment that I believe was greatly appreciated by Quebecers and by Canadians, a commitment that I think says a great deal about the ability, flexibility, and willingness of our Canadian Armed Force members. Thank you. My follow-up question, in fact, is for Dr. Tam or Dr. New. It has to do with contact tracing. You said that that would be critical next steps. I'm wondering, is this going to be through some kind of application or technology? How is this going to take place? Answer, this is Dr. New. Thank you for the question. Yes, as Dr. Tam and I have stated several times, contact tracing and follow-ups are among our priorities in responding to COVID-19. Provinces and territories have also deployed all kinds of resources for such contact tracing. At the federal level, we also have staff that can contribute according and help provinces and territories to do this contact tracing and follow-up testing. When it comes to technology, of course, there are all kinds of apps that may prove useful for this contact tracing effort. All options remain on the table, and we know that some provinces, for example, Alberta, has already launched an app for this purpose. But at the federal level, we are always open to considering a whole range of such apps. And if and it could be a very useful aspect. But there are other considerations too, of course. It's also very important for Canadians to protect their privacy and their personal information. And so, considering all aspects of the issue, it is certainly something that we are discussing a great deal at this time. Thank you. Thank you, Doctor. This brings today's press conference to an end.